Good morning and welcome to today's Recovery Summit presented by St. Clair County Community Mental Health and with support from St. Clair County Health Department. Today's presentation is on opioid settlement funds, state and local perspectives. Before we begin, we would like to go over some general reminders. Please use the chat feature for all questions or comments. Our presenters will be answering questions as time allows. Today's presentation offers one social work CE and one MCBAP credit. If you are requesting professional credits, you must remain on the webinar the entire time for credit. There will be a survey following the conclusion of the webinar. Those of you that are requesting social work CEs, a completion of the survey is necessary. Now I would like to introduce today's presenters. Patrick Patterson is the Executive Director of the Blue Water Recovery and Outreach Center, also known as BW-ROC. Amy Delinky is the Technical Advisor of Opioid Settlement Funds, Planning and Capacity Building for the Michigan Association of Counties. And Brandon Houle is a Technical Advisor on the Opioid Settlement Funds with the Michigan Department of Health and Human Services. Thank you all for presenting today, and so you can go ahead.
Good morning. Thank you so much for having us today. Really excited to be able to share this information about the opioid settlements and co-present with Brandon and Patrick here. So I'll jump into a bit of an overview and we'll kind of transition throughout today's presentation to cover both the state and local perspectives from the Department of Health and Human Services as well as the Opioid Advisory Commission. So what we know at this point is that the state of Michigan, both local and state level, will bring in about $1.5 billion from settlements. So we have a lot of national settlements, the ones that folks have heard most about, and one local settlement that we'll talk about as well. But as we look at the table on this page, we see that it's primarily a 50-50 split between dollars that are going to the state level and dollars that are going to the local level. With the J&J and distributor settlements, these are the ones that folks have heard most about and the ones that we started seeing payments come into both the state and local governments in January. So with these, we'll have some requirements that align with some of the other settlements that I'll talk about in a minute. But we did see the payments for these start coming in January 31st. With the pharmacy and manufacturer settlements, what we're talking about here is CVS, Teva, Allergan, Walmart, and Walgreens. We do have a few that are still kind of outstanding. None have started paying out yet, and tomorrow is the close of local government sign-on for the Walgreens settlement specifically. Again, we're looking at a 50-50 split with dollars to the state level and dollars to the local level. And when I say local level, I'm specifically talking about counties, townships, and cities. So all of them had the ability to sign on. It does not mean that all have done so. We also had the Meyer settlement. So this was not a national settlement. It only was for a few states in which Meyer is conducting their business. And in Michigan, because this one was not as well known, we only had 4 counties sign on, 3 cities and 6 townships. So the folks that did sign on to those settlements did receive a higher amount of funds because there were so few signing on. With the requirements for all the settlements that I've just spoken about, with the exclusion of Meyer, we have a few different kind of guiding documents or items from the settlements themselves that really gauge how these funds can be used. And so we have Exhibit E, which is the list of allowable uses for all except Meyer that I've spoken about so far. With that, that document is considered legally non-exhaustive, meaning it does allow flexibility for both state and local governments to carry out activities that may not be explicitly outlined in Exhibit E, but there are other requirements for use of those funds as well. So 85% of the funds have to be used for opioid remediation, and I'll provide that definition here in a minute, with 70% of the 85 being used for future opioid remediation, so activities that have not yet taken place. This allows a government to have 15% of their funds, of that 85%, be used to reimburse the government for opioid remediation activities that have already taken place. Now, when we look at the definition of opioid remediation, we see that it also is slightly vague and does allow for some flexibility. So we have treating opioid misuse or abuse. We have opioid or related disorders, meaning that governments can address co-occurring disorders. They also can address polysubstance use. So we do have flexibility to really address the overdose crisis as a whole, as opposed to just the opioid epidemic. And we have some additional settlements coming to Michigan as well. I'm sure you all have heard about some delays with the Purdue bankruptcy plan. So Purdue and Endo are the two that we do not necessarily have information on at this point. It's just too early to tell as they go through that bankruptcy plan process. But we have started receiving funds in Michigan for the Mallinckrodt settlement. Now, that settlement is structured very differently. All of those funds, minus a small chunk, which I'll mention, go directly to the state. And then the state's opioid task force will make recommendations on how to use 70% of those funds at the regional level. Now, we do have 5 counties that are receiving a direct distribution of funds, so money that will not be going through the state then to the locals, and those counties are the ones with the highest population in the state. But again, we aren't sure exactly how that money will go out, who will be able to apply for those funds. If folks will be able to apply, we will have to wait on the opioids task force for more information on where those funds will specifically be utilized. The other item to keep in mind with the Mallinckrodt settlement is there is a possibility that they file a second bankruptcy, which would potentially put these payments on hold and then have to kind of restructure or determine a new total moving forward. So while we're anticipating $37 million at this moment, that does not mean that we will be receiving that in Michigan. Now, the reporting requirements for the J&J distributors, CVS, Teva, Allergan, Walmart, and Walgreens settlements, those require that a government input into the Brown-Greer, the National Administrator System, every 6 months, only information that they have about expenditures that do not align with the definition of opioid remediation or do not align with Exhibit E. So if a government chooses to fill potholes or fund law enforcement, those types of items will have to be reported every 6 months, and they are capped at about 15%. So if they go over that, they risk possible lawsuit if it's a county from the state, or they risk being out of alignment with those settlement documents that they agreed to. When we talk about Mallinckrodt, we do have much more extensive reporting requirements. Since there are not reporting requirements on what is used for opioid remediation with the others, we'll see that being different with the Mallinckrodt settlement. So a lot of information on this slide. Block grantees, those 5 counties receiving funds directly from Mallinckrodt, will have direct reporting to this settlement, but the rest of the funds that go through the state will probably have those requirements tied into any sort of grants or funds that are given from the state, and the state will be required to do that reporting. Now, the Michigan Association of Counties just received a grant from Bloomberg Philanthropies where we are looking at incentives for reporting. We know how important it is to understand where those dollars are going for purposes of opioid remediation. And without a requirement to do so, MAC anticipates sending out a voluntary annual survey that will allow counties to share the information about which buckets that money is going into, what types of strategies they're funding, and we'll be able to share that on our dashboard that's currently on our website. So we hope to see that roll out in the winter, and we do have some activities taking place that would ideally provide an incentive for folks to report. Now, this is the dashboard that's currently on the Michigan Association of Counties Opioid Settlement Resource Center. So at the top, folks are able to choose from a drop-down that allows them to see what are the estimated totals for each settlement for that specific county. At the bottom, they're able to see what are the maximum number of payments for each settlement. Now, while we would think that these payments are coming in on an annual basis, and they may, these companies have the ability to really front load their payments. So provide 5 years of money at one time and then not pay necessarily the next year, or 2 years of money at one time and then not pay. So the companies are not able to skip payments for consecutive years, but they are able to skip payments, and those annual amounts that would be coming to a government will be different. So we're not going to say there's 50,000 coming in on an annual basis for X number of years. 1 year it may be 10,000, 1 year it may be 20,000. We're expecting to see discrepancies from year to year. And then on the bottom left of this dashboard, folks are able to scroll over and see what the estimated total amount is on the state side, as well as on the local side. All right, and I will turn it over.
Thanks, Amy. My name is Brandon Houle. I am the technical advisor on the opioid settlement funds with the Michigan Department of Health and Human Services. Thank you all for joining us first thing after the long weekend. I appreciate you being here. Next, please, Amy. Okay, so as Amy mentioned, Exhibit E is a document attached to most of the settlements at this point. Exhibit E has two main sections: the core strategies and the approved uses. So the core strategies are meant to be prioritized over the approved uses. However, everything in both sections is an allowable use of the funds. So the core strategies, there's a number of types of programming included, but also populations. So expanding naloxone or other FDA-approved drugs to reverse opioid overdoses, and increasing access to medication-assisted treatment or medication for opioid use disorder, addressing the needs of pregnant and postpartum women, expanding treatment for neonatal abstinence syndrome, expanding warm handoff programs and recovery services. We'll talk a little bit more about that later. And then, focusing on incarcerated populations, focusing on prevention, expanding syringe service programs, and then, in a lot of the settlement, what we'll talk about with a lot of the settlement is, the need for better data collection. The settlements present us a really unique opportunity to kind of look at some of the gaps in our substance use disorder ecosystem, and really fill some of those gaps and look at and look at how these investments can have a long-term effect. Next, please. So the core strategies are the priority. However, Exhibit E also provides a non-exhaustive list of approved uses. So more generally, treating opioid use disorder, supporting people in treatment and recovery, connect people who need help to the help they need, connections to care, so addressing the needs of criminal justice involved persons, and addressing the needs of pregnant and parenting women and their families, including babies with neonatal abstinence syndrome. And at this point, I'll turn it over to Patrick. Thanks.
Thanks, Brandon. Next slide, Amy. I'm Patrick Patterson. I'm the vice chair of the Opioid Advisory Commission, and I serve as lived experience on the commission. In 2021, faculty at James Hopkins School of Public Health convened a coalition of over 30 professionals and advocacy orgs aimed at guiding state and local spending on opioid settlement funds. The hope was to avoid mistakes of 1998 tobacco settlements, where spending on settlement funds were used for projects unrelated to the intended purpose. Organizations of the Bloomberg Hopkins Coalition include the American Medical Association, the American Association or Society of Addiction Medicine, Faces and Voices of Recovery, National Association of Rural Mental Health, and the university affiliations of Yale, Harvard, Columbia, USC, and Boston University. Next slide. Spending principles. These are our guiding principles on how to spend the money. Spend money to save lives. I can't emphasize that enough. Use evidence to guide our spending. Invest in youth prevention. Focus on racial equity. Develop a fair and transparent process for deciding where to spend the funding. Next slide. Spending money to save lives. Establish a dedicated fund. Don't spend all the money at once, and report to the public on where the money is going. Principle number 2, use evidence to guide spending. Direct funds to programs supported by evidence. Remove policies that may block adoption of programs at work, and build data collection capacity. Principle 3, invest in youth prevention and direct funds to evidence-based interventions. Principle 4, focus on racial equity. Invest in communities affected by discriminatory policies. Support diversion from arrest and incarceration. Fund anti-stigma campaigns. And involve community members in the solutions. Principle 5, develop a fair and transparent process for deciding where to spend the funding. Determine areas of need. Receive input from groups that touch different parts of the epidemic to develop a plan and ensure that there is representation that reflects the diversity of affected communities when allocating the funds. Next slide. The Opioid Advisory Commission was established in May of 2022 per Public Act 84 of 2022. It is comprised of 12 legislative appointed members, including community leaders and subject matter experts in the field of addiction medicine, behavioral health, recovery, prevention, and the criminal legal system. It was first convened in August of 2022. Next slide. The critical tasks of the OAC are to review strategies for initiatives and activities related to SUD and co-occurring mental health conditions, establishing priorities to address SUD and co-occurring mental health conditions, included conducting a statewide needs assessment, and a major big focus of the OAC is recommend funding initiatives to our state legislator. The charge of the OAC and critical tasks is to provide an annual written report to the legislators and executive leadership of the Legislative Council, develop goals and recommendations for prevention, treatment, recovery, and harm reduction, provide goals and recommendations to reduce disparities in access to programs, services, and supports, and to recommend policy as determined necessary by the Commission. Next slide. Strategic priorities developed by the Commission to support strategic planning and recommendations. The 4 areas of focus are prevention, treatment, recovery, and harm reduction. Next slide. Our guiding principles are developed by the Commission to help guide strategic planning, funding, and policy recommendations of the Commission, which is advancing health equity, affecting stigma change, expanding cross-system collaboration, enhancing whole person care, promoting service innovation. Next slide. Key takeaways from the 2023 annual report is to increase public transparency, expand community engagement and inclusion, including tribal engagement and inclusion efforts, enhance meaningful collaboration, and increase legislative oversight and monitoring. And our next steps will be to increase community inclusion and elevate voices impacted by the opioid epidemic in the conversation. We'll be having listening sessions that will be completed in each region over the next 12 months. I believe Region 10s will be sometime in the winter. We are to produce an annual report, but we're also going to be producing quarterly reports as sort of sub-reports. convening an advisory work group with the OAC representing key sectors and communities, community engagement and planning collaboratives. Thanks, Amy. And I'll pass it back to Amy.
Thanks,
Hey,
Patrick.
Patrick, I wanted to let you know there was a question in the box. And do you want to wait till the end to take it or take it right now?
Let me take that at the end.
Okay, sounds good. Thanks,
Give you a
Patrick.
chance to read it.
Sorry, Amy, go ahead.
No problem. So jumping into kind of the local perspective, the Michigan Association of Counties is able to provide a lot of support to local governments throughout this process. We know that it has been very complicated and constantly changing. So my role started last November and ends next September, really to help counties specifically create a process for how to plan, utilize, spend these funds over the next 18 years. So I'm able to provide support for general questions, understanding the landscape of the settlements, also strategic planning, policy analysis, any sort of technical assistance that may be needed. And as counties move through this process, we're seeing a lot of need for administrative support, template documents. So our website does have templates that have been created so far for counties, such as contracts and spend plans and other things that they may need, as well as linkage to other resources. So while I'm one technical assistance provider that can support in Michigan at no cost to counties, we do have about 18 other free technical assistance providers, both locally and nationally. And Brandon will talk about some from the state level as well. Right now, we do have 60 counties that have engaged with the Michigan Association of Counties on technical assistance and other forms of support. So we do have some folks requesting information, and then we do have folks that are working with us every single month to make sure that they're moving in a direction that they feel comfortable with and that their community feels comfortable with. So we do also have a toolkit that we released in January that talks about, in an ideal process, how would a local government move forward with the planning. So I just wanted to provide a brief overview to you all so you know what we are really advising local governments on. So with this, we kind of walk through an overview of the settlements at that time. A lot of information has shifted since then. We take a look at both the Johns Hopkins principles that Patrick just spoke about, as well as some of the other principles that have been put forth by Harvard. Then we walk through really 4 steps for spending. So looking at the stakeholder engagement, data gathering, information gathering, determining where each county is individually in this process. So some communities have put a lot of work in over the last few years, while this is the first time that other communities are addressing substance use or the overdose crisis. And then looking at monitoring accountability. So things like evaluation and reporting to make sure that that public transparency is a component of this process. And then we walk through some of those strategies for spending in the document. So I won't read you everything that's on these slides here, but just wanted to, again, provide more of a look at what we are recommending and what we are advising on. We know that every community has local experts, and so really asking government stakeholders to bring those folks to the table to be a part of the discussion and planning, as well as bringing an equity lens to all of this work and incorporating and engaging folks with lived experience with substance use disorder or persons who use drugs in the process. As we ask folks to gather information, we do have needs assessments that are available to counties or being provided to counties through an MDHHS contract currently. But at MAC, we've put together a resource library and have provided kind of a list of places where we know county level data is available for folks to start pulling that from, and then really encouraging them to connect with their local medical examiner, their local health department, their local CMH, to be able to gather any additional data that may be helpful in determining what the community-specific needs are. When we get to where counties are or where folks are really starting out, some communities have an existing strategic plan in place around substance use. Some already have an opioids or overdose task force in place, but other counties may be interested in starting those. And so we've really asked for some more information to help them figure out where they need to be. Are they able to start with developing a spend plan at this point, or do they need to go back and gather more information because they're not quite sure of those needs yet? And then with the reporting and evaluation piece, as I mentioned earlier, the reporting requirements are extremely minimal. And so we are really asking local governments to think about the way that they would contract for any grant that comes through and the metrics that are required there. We know that the National Association of Counties, in partnership with Vital Strategies and Johns Hopkins, are putting out some evaluation tools in the near future, but really trying to get folks to think about, is this something that we want to gather information on to fund long-term? And how do we continue to have the idea of sustainable programs and sustainable funding for the foreseeable future? One other thing I didn't mention earlier is that there is no time frame on when these funds need to be spent. So we really want communities to not try to spend all of their money up front, but again, think about what are the sustainable solutions. The governments are not receiving these funds because the governments were harmed. They were receiving these funds because their communities have been harmed. And so that stakeholder engagement and long-term planning are really going to be critical to the successful use of these funds. Back to you, Brandon.
Thanks, Amy. Yeah, again, my name is Brandon Hool. And my role here as technical advisor with MDHHS is to basically help develop a process for investing these funds at the state level and making that process accessible and transparent for our communities here in Michigan. So a lot of this work started before I came on back in January, but I'll describe it as best as I can. So in 2021, to prepare for the settlement funds, MDHHS administered a survey and contracted with the Center for Health and Research Transformation, or CHART, to analyze the results of that survey. The survey questions were based on federal settlement funding strategies in the state's opioid strategy strategic pillars. The survey was offered in English, Spanish, and Arabic. We got about 1,040 respondents, which represented 78 of our 83 counties. Next. So the survey's purpose was to gather data to understand the priorities among the respondents from Michigan. There were some limitations with the respondent pool. You know, this was just one survey in preparation and for this. The survey was administered using a snowball sampling method. So organizations, 45 organizations received the survey and were asked to share with their networks. Most respondents were affiliated with an organization. And then only 11% of respondents identified as being racial minorities. Not all regions were represented proportionately. So, example, we had really limited responses from Wayne County, which is pretty densely populated. But from that survey, we determined 3 community priorities for investments, and that was recovery support services, prevention programming, and expanding access to medications for opioid use disorder. Next, please. And so a more expanded list of the priorities that we identified. So you can see additionally support for pregnant and postpartum women, naloxone distribution and training, treatment for incarcerated populations, syringe service program expansion, and research and evaluation of abatement strategies. Next, please. So we looked at the results of the survey. So we looked at the feedback from the community, but then we also looked at the data that we had internally at MDHHS and looked at some of the priorities that we were seeing. And there were several priorities that we identified from the state perspective. However, the most glaring was the racial disparities in health outcomes for people using opioids. And we can see where the overall population, which is really driven by the white population, being the majority population. So when we look at data, overall state overdose death rates, where we see declines, where we see kind of things evening out, we continue to see increases in overdose death rates, especially among Black Michiganders. And that disparity continues to increase, but we also see disparities with people of Hispanic ethnicity, and then also with our Native American population. So we realize that strategies that are going to, affect the overall trends may not be effective with different populations. And so we really need to broaden and focus on equity to see more similar results in all of our populations. Next, please. So we talked, Patrick talked about the Opioid Advisory Commission, so I'm not going to talk any more about that, but really guiding the state's investments. So the Opioid Advisory Commission is focused on the opioid settlement funds. Now, the opioid settlement funds are a lot of money, but out of the total funding that we invest in the substance use disorder and opioid space in Michigan, they're relatively small amount of money. So guiding our overall state investments is our opioids task force. The expanded task force was created in 2022. The task force has representation from several offices of state government, but also the expanded membership includes representation from our PHP regions. So more broader representation. The opioids task force in Michigan is also advised by a racial equity work group, a group formed really to recommend strategies and advise the task force on racial equity. Again, aligned with that priority of the state. Next, please. So guiding the overall state investment in the substance use disorder, opioid use disorder space, we've got this 8-pillar strategy. And what we did to plan for investing the opioid settlement funds is, looked at the state data, looked at the community needs, and then looked at where the gaps in our strategy and what we were already funding existed. So that was our strategy with the opioid settlement funds. Look at what's going on all over the state and use these funds to address areas that we couldn't necessarily address with other funds. A lot of the funds we receive for substance use disorder are federal funds. They're highly restricted. There's a lot more flexibility with the opioid settlement funds. So next, please. So what we did in April and May of 2022 to determine our 2023 investments, the program area leads met to draft a consensus spend plan. It was developed based on identified needs in the opioid strategy to address the fiscal year supplemental request, which was $16 million in the 23 authorization. So right there, we had about $40 million. And, as Amy talked about earlier, the payments can be somewhat irregular. So we have to determine what the best strategy is at the state level for determining the amount each fiscal year. and it can be a challenge. So in June of 2022, the deputy directors of relevant administration areas met to discuss the consensus spend plan. The plan was approved at this meeting. In July 2022, the legislature approved the funding without restrictions. December 2022, the first payments were made, or the first payment was received by the state of Michigan for the distributors. And then January 23, the first payment from Janssen. So, this was the 2022 spend plan that we were developing. And as you can see, we received, some of the funding. It was a 23 plan. Usually our fiscal year starts in October the year before. So our fiscal year started in October of 2022. We didn't receive those funds till almost 3 months later. So the first, there were some challenges in the first year of investing. Next slide, please. But this was our intended spend plan for approximately $39 million. So we kind of broke it into the areas of our overall opioid strategy, our state strategy. 4.5 million in prevention, and that includes both primary prevention and tertiary prevention. So we're looking at, ACEs, which adverse childhood experiences also often contribute to worse substance use disorder outcomes. We're looking at awareness campaigns, but we also looked at quick response teams. A quick response team is a multidisciplinary team that responds after there's an overdose emergency. And links people to care and treatment and provides support. We looked at treatment, $9.1 million. This included staffing incentives, so loan repayment for professionals working, student loan repayment for professionals working in the substance use disorder space, infrastructure grants. We knew that our current treatment infrastructure couldn't support our growing need for substance use disorder treatment. So these grants allowed building expansions, renovations, those kinds of things, things that other grant funds were not available for. And then we also looked at future remediation by expanding capacity to treat stimulant and polysubstance use. And some of these are still in the works. We were just figuring out how to do this. The funds came in late. So even though these amounts are in the spend plan, does not mean we've actually spent the money yet. And so that is one we are still working on, looking at incentives for engagement and recovery services. And that's how we're looking at polysubstance stimulant use right now. In the recovery pillar, we had 7.6 million. This included supplementing grants for recovery community organizations. There's actually a state appropriation that supports those organizations, but they have not had the historical support, and therefore there's emerging evidence, there's promising evidence that these recovery community organizations are going to be really effective at supporting people in recovery. And so we wanted to supplement that state appropriation so that we can see the maximum effectiveness of those organizations that have not had the historic support. Recovery housing, we're looking at releasing some recovery housing grants and then additional recovery support. So there will be more projects in that area that have been proposed, obviously not spent on yet. Harm reduction, 8.5 million. We supported our growing naloxone portal. So for those unfamiliar, in the state of Michigan, organizations can go to our naloxone portal, bulk orders of naloxone, have it sent to them to distribute to the community. There's increased need with that portal, so we were able to support that. Syringe service programs operations. Syringe service programs, there's a large network of syringe service programs in the state. But the funding for those programs, the federal dollars, there were some restrictions which really hindered the growth of those programs. So we were able to use opioid settlement funds there to see the maximum effectiveness of those programs, and then other initiatives that didn't fit neatly under other pillar areas, about $9.3 million. So focusing on the incarcerated population, again, with medications for opioid use disorder, we're looking at expanding these medications in jails and prisons. We're looking at improvements to our overdose surveillance and our other data systems. We've invested in high-tech screening expansion for pregnant individuals, so detecting opioid use disorder early and getting them the resources they need to support a healthy birth and support mother and infant health, rooming in for infants, and then also providing technical assistance, as Amy mentioned earlier. We have contracted with Michigan State University, University of Michigan, and Wayne State University to provide no-cost technical assistance to local governments as they develop their own spend plans, perform their own community assessments. And so the Technical Assistance Collaborative is just another of those technical assistance resources available to help local governments plan and make the most of their investments. Next, please. All right, so goal launch date was August for our website. Hopefully nobody noticed that there at the top. Our website has not launched. It should launch in the next week or two here. The website will contain an overview and a status of the settlements. It'll have resources to support implementation of local abatement strategies. So a lot of links to resources that have already been created. Amy has some really great ones with Michigan Association of Counties. It'll provide more information on allowable uses for funds, resources to create spend plans. There will be a form for accessing technical assistance from the Technical Assistance Collaborative, so from those 3 universities. We have information, detailed information on the state planning and investments of the opioid settlement funds that will be kept up to date. So you see current spending status on those investments. You'll see annual reports from those investments. We'll have more information on our equity specific investments and our equity considerations in all our investments. And currently you can contact us at MDHHS. We love community feedback. We want to hear your stories. We want to hear your questions. You can write into our inbox, which is mdhhs-opioid settlement help@michigan.gov. We'll do our best to triage your information or your question and get back to you as soon as possible. Thank you.
And we just wanted to provide some links if this presentation is shared with you, so you all have access to some of the tools and resources that we've been mentioning today, including the Opioid Advisory Commission's annual report, MDHHS's current spend plan, and the Michigan Association of Counties Opioid Settlement Resource Center. So I will put up our contact information here, but I think at this point we are able to take any questions. Patrick, I don't know if you want to kick us off with jumping back to the question in the chat.
Sure. I can read the question out loud and then go ahead and answer it, and we can maybe collaboratively answer them if possible. It seems like the question is, it seems like all of this money is being dispersed to organizations, agencies that it is going to have an indirect impact on those with an SUD. has any thought been given as to how to spend this money on a more direct impact approach, i.e. someone who has been introduced to opioid narcotics by one of these companies, developed an OUD, opioid use disorder, and was stuck in the cycle of addiction for years? How is this person directly benefiting from this settlement? I would have to say, from my perspective, and then Brandon and Amy can jump in, I would need a more specific example on the money going to an indirect impact. Again, it's got to go to Exhibit E. So if it's not aligning up with Exhibit E in the core principles that we talked about earlier, mainly spending money to save lives. Are we spending money to save lives? I'm not in a position of authority to say if you spend it not in accordance with Exhibit E, there may be consequences to that. I don't know what that is, but I think that those are strongly encouraged to spend money to save lives. This has got to go to those families that are affected by the opioid disorder, and those who struggled with opioid use during the opioid epidemic. And I think that our lens is always got to continually going back to that. And, that's why we're putting on listening sessions to those with lived experience and those that were affected. So is the money helping out, and how can we better direct those funds to save lives? Amy or Brandon?
Yeah, thanks, Patrick. I think that's a great answer to that question. And, just to add, like I would love to see that everybody who's been harmed by these medications and the irresponsible practices here is compensated for their losses and for their trouble. I think that it would also be really hard to determine, the levels to compensate, and because that loss and that pain is so subjective and varies so much between individuals. I think it would be very hard to determine. I think the strategy we took was moving forward, like, let's provide resources to reduce the ongoing harms, and let's look down the road and invest in strategies that they're going to stop this from happening again. And I think that's what we've done in this, and it is it is unfortunate that people won't be individually compensated for their trouble, but I think this is the better strategy we can have moving forward.
Go ahead, Amy.
Oh, no, I completely agree with both of you. And I think the other kind of consideration here is really why community engagement is so important in this decision making, because I do believe that there are services that can be funded that help folks that have been most profoundly impacted. And so as we work with communities and ask them to bring in their stakeholders, what are those services that folks need to continue getting care or continue seeking some recovery pathway, and being able to fund those services for that continued support. So I know it's not, going directly to those most profoundly impacted, but I do think that with community engagement, there are ways to still serve that population with these funds.
I think it's also important to just an observation is that the state and each community, the state has an ecosystem in it, and that breaks it down into each community has its own ecosystem. And when we're looking at spending dollars to save lives, and we just look at one area of that, are we then putting stress on another area? So I think it's also important that we have a broad perspective on making sure we're spending money proportionately between recovery, treatment, prevention, and harm reduction, so that it doesn't put stress and overweight in one area of that ecosystem, which will then, it won't be healthy.
I can jump to another question in the chat as well. So any suggestions on finding out what is happening at our local community level? So folks are able to check in with their county, city, township leadership to see what's happening there. If you're not quite sure, you're welcome to reach out to me. I can try to help direct you and sort of helping understand where folks are at or who those folks may be to just get an understanding. But right now, we're not seeing a lot of publicly available information on what's happening at really any level in terms of spending yet. And so I do anticipate that next year we will see more of that. Most counties that I'm working with are really in the early stages. Most places have not spent any money yet, have not developed a spend plan yet, have not even chosen kind of the priorities or strategies that they're going to be moving forward with. So the likelihood that community has spent already is pretty low, although some are moving relatively quickly, but happy to help in that process if you'd like to reach out.
Amy, the other one is I'm not sure if that's a question or a statement. Do you want me to read that? No. I work with several children that are reported to have been born positive to opioids. The families I work with are in need of additional supports. Many grandparents are raising their grandchildren as a result of their children's opioid use and deaths. That's a prime example of why the settlement exists and that the primary focus of where those funds are. It's going to take some time for that to filter through the system before those families feel and see the effects of additional supports in their communities. But that is a big focus.
Yeah, I did want to say that we have started to look at that, grandparents raising children at the state. It's yeah, we are still figuring out how to do all this and how to make the best of this funding opportunity. So it is a population we've been looking at.
Any other last minute questions?
Well, thank you so much for having us. It's really great to be able to get this information out there. We are all really accessible, so please feel free to reach out to us with any questions or additional information.
And I want to add, just as a reminder, the Recovery Summit is going on all month with different topics and speakers planned each weekday. Tomorrow's presentation will be at 9 a.m. presented by Jennifer Mitchell from McBAP on the benefits of specialty substance use disorder credential. To see information and register for additional sessions, please visit sccmh.org under the events tab and Recovery Summit. I want to thank you to our presenters, Patrick Patterson, Amy Delinky, and Brandon Houle. Your time and information is appreciated. And thank you all to who attended this morning. Have a great day.